So fast forward through the next 9 years, now in 2023, the majority of patients now, whether they're in their 60s or 80s, they can have their hip or knee replacement. I can do it in under an hour. They're walking on in a few hours, and most of them are going home that day.
Wow, that's incredible.
Coming to you straight from Fremont, California, this is the Fremont Podcast, dedicated to telling the stories of the past and present of the people and places of the city of Fremont, one conversation at a time.
Hello, Fremont. This is Mindy. You are listening to episode 80 of the Fremont Podcast.
Now, here's your host, Ricky B.
So I'm going to go ahead and start. I am with Dr. Alexander. You go by Alex?
Professionally, they go by Alexander.
There you go. Okay. Dr. Alexander Sa. He is an orthopedic surgeon at Washington Hospital, and he has lived here his entire life. You were born at Washington Hospital. Is that right?
I was, Ricky. I was born and raised at Washington Hospital. My parents moved here back in the 70s, where my father was a head and neck surgeon, and he was on staff at Washington Hospital for 40 plus years. So he was a head and neck surgeon and served this community both as a physician. He was on the board for Washington Hospital. He was chief of staff. He remains working at the hospital on a volunteer basis, as my mother has, both of them for 50 plus years.
Wow, that's incredible. If you don't mind me asking, where did they move from? What was the story of them coming to Fremont to find Washington Hospital?
So when people meet me, they often will ask where I'm from. They often can't tell either by the last name or by my appearance. And people are often shocked to find out that both my parents are Chinese. They actually both moved here when they're about 8-10 years old. So my mom moved to Illinois. My father was in San Francisco. And then they met when he was finishing school out in New York. And then they moved to California, where he did some Naval Academy work and was in the service for a period of time. But then they settled down in Fremont in the 70s.
Wow, that's really cool. And then he became a surgeon pretty early on in the 70s?
That's right. So he started his practice here. So this was his first practice. He was in private practice.
Okay.
And he had two partners, and really they were the primary ear, nose, and throat group in the city. And so they are very well known, taking care of a lot of the community members. And what's really fun coming back as a surgeon at Washington Hospital, I think I'm the only surgeon to come back who was actually born at that hospital. I now serve the same patients that my father treated, or I will treat their children. So they will frequently tell me, your dad took care of me, or your dad took care of my son.
Wow.
So it's always great to hear these stories.
Wow. What are some of the things that, when I was growing up, and I remember as a child hearing my parents tell stories of particular places that they were fond of, or things that were kind of unique to, like my family moved from Wisconsin to South Carolina when I was 10 years old. And I remember some of those stories of what it was like to get settled into a new place and all of that. What are some of are there any particular stories that your parents tell, or that you remember them talking about when you were younger, about coming to Fremont, like what Fremont was like, and maybe some of the things that they found to be special, or maybe even a little bit funny, or just different?
Absolutely. Since my father was from San Francisco and my mother from Illinois, obviously when they came here and settled, they wanted to start a family. I have two older sisters, so they were about, one's 8 years older, one's 4 years older, and again, I was born here in the mid 70s. And they settled here and wanted to start a family here. And Fremont in the 70s was very different than what it was today, right? There was a lot of agriculture, a lot of farming, a very tight-knit community. And you still see a lot of that, but certainly has changed dramatically in the recent decades with the expansion of Silicon Valley and the Googles and Facebooks and everything else. But what really holds true still to this day are the people of Fremont. So like Ricky, the people really feel a sense of community here. I think Fremont's routinely called the best city in America to raise a family.
That's right.
Right? Safest
That's right,
and happiest city. And when you work at Washington Hospital, a small community hospital that's been serving this Tri-State community for decades, you will meet volunteers there who, like my parents, have been there for 4-5 decades.
Wow.
Committing their life, committing their time to serve this hospital, serve this city. you don't find that in many places, right?
True.
People
Yeah.
really feel a commitment to this community, which is really something to be proud of, I believe.
That's cool.
And so that's why I came back, and that's why I'm so proud to serve the same community, because Fremont really is a great place. As you raise your family here, right? You get to see the opportunities that your children have by living here.
That's cool. That's really cool. You mentioned that's why you came back. I'm wondering, what's your story? You grew up here. Where'd you go to high school or elementary school? And then, where did you get your training from? And was there a point in time where you thought about, pursuing a career somewhere else? Tell me a little bit about yourself.
Sure. So born and raised here in Fremont. I went to Fremont Christian right down the street.
Okay.
And then I went to Parkmont Elementary about third grade. So very local here, right around the corner. And then I went to Centerville Junior High. And then for high school, I probably would have gone to Washington High School, but I went to a private school up in Oakland called the College Preparatory School.
Okay.
My father and older sister went to a small liberal arts college in Philadelphia called Haverford College. It's a very small, it's part of the community with Swarthmore and Bryn Mawr colleges, so some people may be familiar with those. But because it was a relatively small school, my dad would do high school interviews for people who wanted to go to that school. So back in the 80s, he was interviewing some kids who came from Oakland, from the College Preparatory School, to interview to try to apply to Haverford College. So he met these students and saw how great they were, what a great high school experience they had. So that's why they sent me all the way up to Oakland for high school.
Okay.
So I did my high school there and then went to Haverford College. So I majored actually in English, knowing that I wanted to go into science, but I wanted to try to learn something else while I was there, knowing I'd commit to the sciences in med school. So I did my med school at Jefferson in Philadelphia, stayed there, met my wife in college, and then after med school went to Harvard for my orthopedic training.
Okay.
So I was 5 years at Mass General and Brigham and Women's.
Wow.
Then after that training, did a 1-year fellowship in Chicago at a hip and knee replacement fellowship.
Yeah.
After that, I came back to Fremont to practice at Washington Hospital in 2008.
Well, that's incredible. That's quite the journey. You had the opportunity to see a lot of different places. I've been to Philadelphia on quite a few occasions, and then Chicago area, Boston even, and you had a lot of places to consider, I'd imagine, going to those different cities for school. Was there anything ever appealing to you about staying in one of those cities for the long haul?
Absolutely. They're great cities. We were very fortunate to be in Philadelphia and Boston and Chicago. My wife and I enjoy them all. My wife was particularly fond of Boston, just a young town, so many things to do, right? So many great schools and parks and museums and food. Winters can be a little bit rough with the snow, but
that's right.
But we loved Boston. A lot of great friends. So if I didn't come back to Fremont, we most likely would be there. I had a lot of great mentors there.
Yeah.
But in the end, it was all about family. My parents are here. They live in the house that I was born and raised in still. I live half a mile away from them. So I learned from my father, live close to work. I have a 5-minute commute to work. I can be at home with my kids for dinner every night. That means a lot to me, just like my dad did.
That's awesome.
And my 2 sisters live in the Bay Area. My grandparents, my uncles, aunts all lived in the Bay Area. So to have the ability to be close to family, we couldn't pass that up.
That's cool. That's really cool. I love that. I love that you were able to get the experience of other places. That's one of the things that I have found. I was just talking to somebody about this the other day. Actually, one of the other interviews that I had. We were just talking about the fact that, when people are, when they have limited experiences or when they have limited exposure, they tend to view things that they've never experienced through the eyes of what they have experienced, And I think that a lot of times, like, for instance, I use this example. So I did not really, I never visited California or the West Coast until about 6 months before I moved here. And that trip was just a quick visit to Fremont to see if this is the community that I wanted to move to. But, on the East Coast and different places, you hear people's opinions about California or whatever. And I never really bought into a lot of those opinions, but I still had my preconceived ideas as to what it was going to be like to be here. When I came to visit Fremont, I tell people Fremont was what sold me on moving out here to the West Coast, because I was not really into, what I might have perceived to be what California was like, which would have been like LA or the big cities and the surfing community or whatever. I was not into that, so that didn't really appeal to me. But when I came to visit Fremont, I found the diversity, I found the family friendliness that you mentioned. I found I could sense immediately a community element to it, and I thought, man, this is a place where I'd want to be. And so it was actually Fremont that really sold me on wanting to move out here when I was considering it. So I love the fact that somebody, and also unlike you, although I wasn't born there, I spent a good chunk of my life in South Carolina, in a really beautiful city, quite honestly. But I've always said that after I left, I wouldn't want to go back and live there for a number of reasons. But I still love where I grew up. It just was not the place where I wanted to grow up. But you are back here, and I think the main reason that would draw me back to where I would live if I were to go back to South Carolina is my family, and so I think that's a good reason. It's a good reason to be there.
No, I agree, Ricky, and I think I appreciate it much more to be here on the West Coast because of those other experiences. You're absolutely right. We met a lot of great people, had a great time in the East Coast and in the Midwest, and the people are fantastic. There are some stereotypes, of course, and some of them do hold true. Yeah. But I think, as you said, to experience other things gives you a different perspective, so that when you're here in California, you realize this is why everyone wants to be here. Yeah. This is why cost of living is so high, because we're fortunate to be in such a great place.
That's great. I love that. We'll be right back. You can hear the rest of this conversation in just a moment. Are you tired of pushy real estate agents who don't have your best interests at heart? Petrocelli Homes Realty Group is the breath of fresh air you need. Jennifer Petrocelli treats every client like family and takes the time to educate them throughout the buying or selling process. With her neighborhood expertise and excellent communication skills, Jennifer helps her client make smart real estate decisions that benefit them in the long run. Reach out to Jennifer today and discover why Petrocelli Homes is the right choice for all of your real estate needs. And now, back to our conversation. You're an orthopedic surgeon. What made you choose going that route, maybe over another route? You said your dad was a back and neck doctor. Is that right?
Ear, nose, and throat.
Ear, nose, and throat. I got close. Yeah. It was the upper part of the body. What made you go the orthopedic route?
So I always enjoyed working with my hands, and so as a kid, I think I'd either be an orthopedic surgeon or a carpenter, one of the two.
Okay.
And really, orthopedics, what I do, you're basically a carpenter of bones, so it's very similar.
Huh.
I grew up around doctors. My dad was an ear, nose, and throat. My uncle was a general internist, and my grandfather was an anesthesiologist. So I've seen a lot of the medical field growing up. But again, I always liked working with tools and with my hands. And so when I went through med school and orthopedic training, by far that was my biggest interest. And I went into a specialty within orthopedics of hip and knee replacement. And that particularly has been rewarding because it's a field where you get to make people better. You really get to make a impactful difference. You get to restore people's lives, their activity, and they're very happy with excellent and reliable outcomes. So for me, it's just been a gratifying career where I love going to work every day.
That's cool. Was there a different field that you had considered at any point besides orthopedics?
Honestly, I don't. People ask me, what other medical field would you do?
No.
I can't imagine not being a surgeon.
Okay.
So I love interacting with people.
Yeah.
I love clinic. I love the patient-doctor relationship. But I do also really enjoy the surgical aspects of the field.
That's cool. I've had 2 surgeries on my knee, and they were not the normal like ACL or what is it? The other one, the MC? Is there an MCO?
MCL, yeah.
MCO, yeah. So when I was 15, I was playing basketball, and I jumped and I had an avulsion fracture. So I had a couple surgeries. Actually, the surgeon said that I probably wasn't going to be able to walk again without a limp. At least that's what he had told me at that time. And I was going to have a limp the rest of my life, and unfortunately, I was able to recover, and I don't have a limp, but that was my first experience with orthopedics, and it was unfortunate at 15 because I said I was an athlete that I was faced with the fact that I might not be able to play sports again, but I played sports in college and everything since I left. So do you find that with the replacement aspect, the knee and hip replacement, do you find that are you working primarily with older people, or do you find it like is your work pretty widespread across a lot of different age groups?
The patient population really has changed over the years. Historically, it's been people in their 60s and 70s. And historically, people would say, hold off on hip and knee replacement as long as you possibly can. But now, because these materials are so durable and people are living longer, they want to stay more active earlier, the age ranges have changed dramatically. So while we certainly have patients in their 60s and 70s, I've had patients just recently as old as 98. This 98-year-old woman lives alone, still drives, and wants to feel even better, so wanted a hip replacement so that she can stay independent. I mean, that's what's kept her healthy for so long. But then on the other end of the spectrum, we have people who just recently, this poor gentleman is in his 30s, but he's had 15 knee surgeries, had disastrous outcome after another, and couldn't live his life. But now he can go back to do things he wants to. So the range is now much wider because the materials, the implants we have last so much longer.
Wow. Have you seen, I'm just curious, as you were saying this, have you seen a change like within the field of orthopedics ever since? I mean, since you've been a doctor, like it seems to me like my mom had her knee replaced. She passed away like 2 years ago, but she had her knee replaced I think 5 or 6 years ago, and it just seems to me like the options are so different than like my grandmother who had her knee replaced maybe 20 years ago or 15 years ago. I can't remember when it was exactly, but it just seems like the options have changed. Have you seen within the time from the time you went to school and actually studied all of this to where you are now, have you seen a significant shift in the options available for people?
Things have changed dramatically, Ricky, over even this short period of time, as you mentioned. So when I finished training in 2008, that's only, 17 years ago or so, you will find that hip and knee replacement patients back then, this is at Mass General, one of the top hospitals in the country. After hip and knee replacement, it would take an hour or two to do the surgery. Patients would be in the hospital for 2-3 days. They would be on crutches or a walker for 6 weeks or so. It took much longer to recover. It was a more painful procedure. It was more involved in terms of the recovery. Over time, things have really evolved due to better surgical technique, due to better pain management, due to just in terms of education to the surgeons of new and evolving ways to do these procedures even better. So as an example, I came in 2008 where people were routinely in the hospital for 2 or 3 days after surgery. In 2014, I was the first surgeon in Fremont to have patients go home the day after surgery or the day of surgery.
Wow.
So people could have a major knee or hip operation, right? Have a replacement and be going home in a day or the same day. So that was in 2014 I started that. I was doing some of these procedures in our surgery center. They don't even have to come to the hospital. They go to the surgery center. So fast forward through the next 9 years, now in 2023, the majority of patients now, whether they're in their 60s or 80s, they can have their hip or knee replacement. I can do it in under an hour. They're walking on in a few hours, and most of them are going home that day.
Wow, that's incredible.
It is. So instead of being in the hospital, instead of potentially getting blood clots or other illness or other things by sitting around the hospital, they are now walking home. At 2 weeks, many will walk with no assist device at all. At 6 weeks, I'll get emails of patients who, I did a woman's double knee surgery at 6 weeks. She's sending me a video of her water skiing in Tahoe. Or we'll get pictures of people hiking Yosemite, a couple months after hip surgery. So it's incredible to see how these surgeries now not only get people back to doing the things they want to, but how rapidly they can recover.
Wow, that's incredible. That's incredible. Just thinking about just if you would have told somebody that like 15 years ago that would be possible. I think there's certain people that would have imagined that and they would probably hope for that, but I just think the fact that that's kind of the standard now is just remarkable.
You're absolutely right. 15 years ago, one of my mentors was doing that. And really he was ostracized by the rest of the orthopedic community. People thought, you shouldn't do that. That's criminal. You know, the routine and the standard should be to keep these people in the hospital. But now the vast majority of surgeons are doing this exact same thing. So to his credit, he foreshadowed what was to come. But what patient wants to sit in a hospital? What patient doesn't want to get up and go home? Yeah. So it's to their benefit as well. Wow. And we've seen the outcomes have been spectacular.
That's great. That's great. And are you, is what you're doing, are you one of the only people in this community that's doing this sort of replacement, or are there other surgeons that are doing that as well?
Yeah, so I actually do more hip and knee replacement surgeries than anyone in Northern California.
Wow.
So I individually do some of the most in the country. And that's why we have this program at Washington Hospital. The Institute for Joint Restoration is a 3-story freestanding building just attached to the hospital. But if you've driven by it, you'll see it just connected by a sky bridge. But it's a 3-floor building only for joint replacement patients. There are 30 private rooms inside.
Wow.
And the nurses and therapists, that's all they do all day long. All they do is take care of healthy people having hip and knee surgery.
Wow.
So they're extremely specialized, an incredibly comprehensive program where the staff is, they're all experts in their field.
Wow.
So we're lucky to have this program. If people look at Consumer Report or Health Grades, other third-party objective, companies that look at outcomes, our joint replacement program at Washington Hospital is one of the best, if not the best, in the state for joint replacement year in and year out.
Wow. That's really cool.
It's amazing, I think, that people who know Washington Hospital appreciate it for how it served this community for so long.
Oh, yeah.
But for many, it's a hidden gem in that they don't know necessarily that the joint replacement program there is nationally recognized. And so with the outpatient joint replacement, which I started back in 2014, again, it has allowed me to lecture at national meetings. It's helped me be involved with research. Even though I'm in private practice, I'm still very active, like on an academic level, in terms of educating other surgeons, sharing data, and being involved with leadership committees in our national organizations. I think that's important to be involved because then you can bring the newest and greatest technologies back to our community here in Fremont, because we want to stay at the forefront.
Yeah.
We don't want to be behind. We really want to innovate and bring our patients the best opportunities. So that's what our group focuses on. And then with anterior hip replacement, my associate, Dr. Bonner, and I were the only 2 surgeons at Washington Hospital to do that unique procedure. And
what is that exactly, anterior?
So hip replacement, there are many different approaches to do it. You can do it from a posterior approach or a lateral approach. Then they can be mini approaches, minimally invasive. But the anterior approach is really something that has revolutionized hip replacement surgery. It was started by a surgeon named Joel Mata back in 30 years ago in LA. He was a trauma surgeon, but he used some trauma techniques and then altered them to be appropriate for hip replacement.
Okay.
Similar to that other mentor I told you about who was discharging people early and was ostracized.
Right.
Dr. Mata as well, there was a lot of resistance as he was showing people this anterior approach. People thought, this is not the way to do it. This is against normal, standard technique. And again, he was also, no one really adopted what he was saying. But then over the past 20 years and then 10 years, over these past 5 years, anterior hip replacement is now the preferred. It's the majority of the way hip replacement is performed in the United States. So the change has been dramatic. And really all the residents and fellows coming out of training are all doing anterior approach. It's really just the older surgeons who haven't learned it, who are slowly retiring, that are doing these other approaches. So anterior approach is really the majority of the way hip surgery is done now. And it's because it's muscle sparing. It goes between a natural interval where you don't have to cut through muscle to get to the hip. So you don't destabilize the hip. All the other surgical approaches, you have to cut muscle just to get to the hip joint. And you can repair it and you do your best, but it's never quite the same. The hip is destabilized with those other approaches, and there's higher risk of instability or dislocation. But with an anterior approach, because you're not cutting muscle, quicker recovery, less pain, you don't have to have hip precautions. And uniquely with that approach, because patients are lying on their back during the surgery, you can use x-ray during surgery. So live during surgery, you can see the implants going in, the size, the placement, the fit, the leg length restoration compared to the other hip. Much more precision and accuracy. with all the other hip approaches, you can't get x-ray until the surgery is over. It's too late to change anything.
Wow.
So with this anterior approach, you will find that people are doing better, recovering faster with much better outcomes. And the literature is now showing that. And again, it's the way the majority of hip replacements are done. So these things have all changed dramatically over the years.
That's incredible. Wow. Don't know that I was expecting a lesson on that, but that I am just fascinated with that. That is really, really remarkable. I'm just thinking back at the, I know knee surgery is very different, but thinking back to my knee surgery and just imagining like, and that happened in 1995, so it was a long time ago. But just thinking about, or 93, 94. Just thinking about that and thinking about how much things have changed since then even to now, I just think that's just really, really remarkable. And you said that you have the opportunity now of lecturing in other places and giving help to people that are also in the same field. What are some of the places, or where are some of the places that you've lectured, or that maybe you regularly train at?
Yeah. So again, being in private practice, it's very easy to sort of stay within your bubble and not reach out to learn what else is new, how to be better. And I've always felt that it's important to learn. Like I said, if I wasn't in Fremont, I would have been at Boston in an academic center practicing there. But even though I'm in private practice here, again, I do more hip and knee replacements than my colleagues at the Stanfords or the UCSF or other programs in the area. And with that volume comes expertise, comes data and research where we can show our experience and teach others. So for anterior hip replacement, I was just recently president of the Anterior Hip Foundation, which is Dr. Mata's foundation. So the way I met him was I was lecturing on other aspects of minimally invasive hip and knee surgery and met him and some of his colleagues. And then they reached out to me many years ago and said, we want you to learn this and teach others. And I only chose to adopt it because they were willing to show me and teach me. And once I did see it, I realized how much better it was and haven't looked back. But I wouldn't have done that if I wasn't involved with some of these other activities in terms of learning from other colleagues, having the benefit of having national experts as colleagues. Where we share ideas. That's where, for example, Ricky, we've learned about other pain management strategies. So the reason people were in the hospital so long 15 years ago, as we were talking about, was because we didn't have good pain management. People were in the hospital getting morphine through their IV, right? They were stuck in the hospital bed to have their pain controlled. Over time, things evolved where things like OxyContin and other narcotics came out, which help with pain, but then obviously all the problems associated with that. That's a whole nother discussion. But then we learned from that experience that if we could manage our hip and knee patients' pain better with our current multimodal pain management strategies, then they could do better. And that's really what I took the initiative to lead in this area. That's what led to the 2014 outpatient surgery, because I was very involved with multimodal pain management, and I still am today. I lecture other surgeons on how to use non-opioid medications to manage pain. If you use many different medicines in smaller doses, like anti-inflammatories, Tylenol, small dose of nerve medications, and then some of these novel medications where I can either inject or instill long-lasting pain medications at the site of surgery. So no systemic effects, no side effects. You deliver it where you're doing the surgery at the site of trauma, but because it gives you 2 or 3 days of local relief at the surgical site, there's less of a need for oral narcotics or other. So you would immediately eliminate some of the side effects of these opioids. So that pain management is what's letting people recover faster, and that's what's helped revolutionize how quickly people can recover after these surgeries.
That's awesome.
But I only learned that because I'm involved with my colleagues across the country. So I'll lecture at our national hip meeting in Dallas each year. I was privileged to be invited to go back to Harvard and lecture about some of my experiences. We talk regularly in Chicago and San Francisco and at our national hip and knee meetings. So I'm going to meetings multiple times a year.
That's awesome.
To share experiences.
Wow. Thanks for sharing that. I was just recently exposed a little bit more to Washington Hospital. I have done some work with Dale Hardware, who's been a sponsor of the podcast for a little while. And we did a fundraiser for there's a mother and child fund that's available in the birthing center for families that have insurance, but they don't quite cover all the needs that might be present when children are born. And so there's a fund available to help out with some of the auxiliary needs that might come about. And so Dale Hardware did a fundraiser for 2 months that raised almost over $10,000 for that particular fund. And so I got the opportunity of going over there with the marketing manager from Dale Hardware to present the check, and they gave us a tour of the birthing center, and it was just really cool to be able to meet the CEO and to be able to sit down with some of the executives over there and just hear about the hospital. I've lived here for about 9 years, and I live, I could walk to Washington Hospital in 10 minutes. I live pretty close to the hospital, but I didn't really know a whole lot about it. But I just think it's pretty remarkable to hear what you're doing there. The fact that that there is everything available that you mentioned. That we have the number one hip and knee replacement center in the state, possibly, or in at least in Northern California. So I think that's just really, really cool. Kind of gives us a little bit more pride in the city to be able to recognize these things and to know that they're here, and that and what we're doing here makes a big difference. That's cool.
I think you're absolutely right. When I was in Boston, Ricky, I was always amazed that Mass General and Brigham and Women's are within miles of each other in this city. And I kept thinking, these people don't realize how lucky they are to have two of the best hospitals in the country right in their backyard.
Yeah.
That always amazed me. But then coming back here to Fremont, as you mentioned, those who know Washington Hospital, once they get to know it, have committed, like I said, decades of these volunteers' lives where they are committed to this city and to that hospital. And to your point, the other people in this city, the other stores, right, and other workplaces all support that hospital, because Washington Hospital has done so much for the Fremont community, and it's always there when you need them. It's one of the best in terms of orthopedics, for cardiac surgery, for neurosurgery. So they have an incredible program, but Washington Hospital's commitment to this community is why it has been so successful. So we're very fortunate to have it.
Well, I'm going to wrap things up here, but I'm just curious, what are some of the things, apart from your work, that you enjoy doing in Fremont? Like, what are some of the things that maybe you and your family do, or things that you remember doing as a child that are still, things that you enjoy in the community?
As we started this conversation, Ricky, we're so lucky to live here in the Bay Area because we have everything at our disposal. We have Tahoe a few hours away. We have San Francisco. We got Santa Cruz an hour away. We have Napa.
Yeah.
We have so many things here that, as Californians, we take for granted.
It's true.
Right? We often don't do it unless someone comes and visits us, and then we're forced to go, and then we realize, wow, this really is a great thing to do.
That's right.
But raising three boys, I have three boys, 20, 16, and 12.
Okay.
And like you, they're athletes. And just like medicine's changed, kids' sports has changed. You and I would play after school, right? It was very simple.
Right.
Now you have to drive all over, weekends, travel, sports. So a lot of the time my wife spends is taking them to their various sports and activities. As they're growing up, one's in college, one's going to be a senior, one's going to be 7th grade. Watching them grow, we're just trying to enjoy as much time with them. So
that's cool.
We appreciate the ability to spend time as a family at the beach, go to the local parks and other things, and be at the great outdoors here. So we try to take as much advantage as much as we can of this place.
That's all. Yeah, I agree with you. It's funny, going back real quick to when I moved out here. I had, and it's embarrassing to me now, having lived here as long as I have, to say this, but when I thought of California, I literally just had Hollywood and the beach in mind. I guess I didn't even realize, and maybe this was like poor. I'm going to blame it on poor East Coast education, but I didn't realize there were mountains in California, and again, that might just be my ignorance. But I started working for REI here in Fremont. I worked there for almost 5 years. And as I began to help people prepare to enjoy their weekends or their times away, I became very familiar with all the places to explore in the outdoor territory. It was within a couple years that I lived here that I have two brothers. One's 7 years younger than me. The other one's 15 years younger than me. And so we didn't necessarily grow up together, or at least because we were so far apart in age, but we found ourselves all three living in California at that point. And so we decided to do a road trip, and we visited all of California's national parks. We tried to visit all of them in one road trip, and it actually didn't happen the way we thought it would. We had 6 of the 8, and then we had to come back 6 months later and hit the other 2. But it just blew my mind, everything that we have here in California, everything that's at our disposal right here. So I'm glad that you're able to enjoy it with the family, and I'm sure the boys will. I know my boy, I have a 10-year-old and almost a 1-year-old, and I love taking them out and being able to enjoy all the things around us. So that's great that you get to do that with your family as well. So, well, thank you for joining me for this. It was great to get to know you. This conversation has given me a whole another glimpse into the Washington hospital / medical community and in our city, and it gives us something else to really be proud of. So thank you for your time and sharing all these things with me.
Thank you, Ricky.
Yeah.
It's really great to have this conversation with you, and I enjoy all your other conversations with the other very interesting people. It's great to hear all these stories we have here locally in Fremont.
Thanks, man. I really appreciate that.
This episode was hosted and produced by Ricky B. I'm Gary Williams. Andrew Cavett is the editor. Rachel Prey is the print editor in charge of our newsletter. Scheduling and pre-interviews by Sarah S. Music provided by Soundstripe.com. You can find everything we make, the podcast, our newsletter, and all of our social media links at thefremontpodcast.com. Be sure to subscribe wherever it is that you listen so you don't miss an episode. And if you would, please leave a review on iTunes. Your reviews help other people find this podcast. Join us next week on the Fremont Podcast.
This is a Muggins Media podcast.